What if you could stop a seizure, pull someone out of severe depression, or turn off chronic inflammation, all without a single drop of medication? There is a master reset switch hidden inside your body, and it doesn't run on chemicals, it runs on electricity. This diagram compares the two modes of your autonomic nervous system, the autopilot running your organs. On one side are the erratic waves of the sympathetic state, driving your fight or flight response. On the other, the smooth, rhythmic waves of the parasympathetic state, controlling rest and digestion. When this autopilot functions normally, it shifts between these states as needed. But in conditions like treatment-resistant depression or long COVID, the system gets jammed. The fight or flight mode locks into chaotic overdrive, and the body constantly attacks itself. For decades, our primary response to these localized electrical misfires has been to flood the entire body with heavy chemical drugs. We distribute compounds system-wide, hoping a fraction of the dose reaches the right target. Dropping a systemic chemical bomb to fix a highly specific electrical problem often leads to severe side effects. The underlying hardware glitch remains untouched. To fix the hardware, we examine the wiring, the vagus nerve. As the main superhighway of the parasympathetic system, it originates in the brainstem. Earning its Latin name, the Wanderer, its fibers wrap the heart, branch into the lungs, and descend into the stomach. About 80% of the fibers in this nerve are sensory, sending data from the organs up to the brain. Because it's a two-way street, doctors realized they could use this route as a backdoor to send manual commands straight to the central nervous system. This practice is called Vagus Nerve Stimulation, or VNS. By delivering mild, carefully timed electrical pulses to the nerve, physicians force the body to deploy its own healing mechanisms. Instead of relying on a pill to cross the blood-brain barrier, VNS uses the body's existing anatomical cables to transmit therapeutic signals instantly. The first major clinical application of VNS emerged in the 1980s as a treatment for severe drug-resistant epilepsy. Surgeons developed an implantable pulse generator, essentially a pacemaker for the brain. The surgical procedure requires precise anatomical placement. Doctors exclusively wrap the titanium electrodes around the left branch of the vagus nerve. The right branch plays a major role in regulating cardiac rhythm, so staying on the left side prevents accidental disruption of the patient's heartbeat. Patients receive a physical magnet to carry with them. If they feel an oncoming seizure, they swipe the magnet directly across their chest to manually override the system, triggering an immediate surge of electricity to abort the attack. Here we can see an EEG recording, tracking brainwaves. When the electrical impulse hits the vagus nerve, it travels into the brain and desynchronizes the chaotic, hyperactive firing patterns that cause seizures, stabilizing the neural network's architecture over time. If you're fascinated by how your body's hidden systems actually work, hit the subscribe button so we can keep exploring them together. 30 years of surgically implanting these generators proved that direct electrical stimulation could reliably override biological chaos. That success set the stage for a less invasive approach. Recent technological leaps have moved VNS out of the operating room entirely. Because vagus nerve branches run close to the surface, new transcutaneous devices access the network superficially through the skin on the neck or outer ear. This diagram illustrates the upward mechanism of action. When an electrical pulse enters the ear, it travels upward directly into the brainstem. This stimulates neural clusters to release mood-stabilizing neurotransmitters, such as serotonin and norepinephrine, making it an effective therapy for depression. The signal can also move in the opposite direction. Pulses traveling rapidly down the nerve eventually reach the spleen. There, they command the organ to halt the production of TNF-alpha. TNF-alpha is a specific protein that promotes inflammation throughout the body. This downward signal acts as a biological kill switch. By shutting off the production of those inflammatory proteins, the vagus nerve suppresses the systemic immune overreactions seen in autoimmune disorders like rheumatoid arthritis and the profound fatigue associated with long COVID. A single, carefully calibrated electrical tap at the surface of the skin simultaneously rewires brain chemistry above and shuts down an aggressive immune response below. Current VNS therapies operate on what engineers call an open-loop system. Like a lawn sprinkler set to a rigid timer, they fire pulses at scheduled intervals, entirely blind to what the body actually needs in that specific moment. This graphic shows the transition to closed-loop systems. Wearable biometrics continuously monitor real-time physiological data like brainwaves and heart rate variability, or HRV. HRV is the measure of the variation in time between each heartbeat, which serves as a highly sensitive indicator of nervous system stress. By feeding this biometric data into an AI processor, the system gains predictive power. It detects the subtle physiological precursors of a migraine or a seizure and delivers a perfectly timed neutralizing dose of electricity before the patient ever feels a symptom. We are moving away from treating the human body strictly as a chemical factory. Instead, we are beginning to manage it as a highly responsive, interconnected electrical grid. The most effective medical interventions of the next decade will not necessarily require a prescription bottle. They may just require a perfectly timed electric pulse.